session on hemovigilance from our wonderful Southern Trust Hemovigilance team. I'd like to welcome Rona, who's very kindly going to walk us through the medical side of the workflow. Rona?
Thanks, Rebecca. So, hello everyone. I am just going to walk you through the inpatient blood transfusion navigator for any patients that are going to be getting a transfusion. I've logged in already. Hopefully you can see my screen in as an inpatient physician. So I've just selected a patient file that I can work with. So to find your navigator, if your navigator doesn't appear across the top of your Epic screen, you can use your more arrow, and this will open up your menu selection and your blood transfusion one. Once you click on it, it will attach to your navigators. If you work in a clinical area where you're continually transfusing patients, you can pin this to your navigator via the wee pin switch. So I'm going to open my navigator. So we're recommending anything that you're doing in relation to blood transfusion, put everything in via your blood transfusion navigator. On the left-hand side, there's a menu list of everything that you need for blood transfusion within that process, so you can access everything that you need. If you click on any of the links, they will flag up to the top of your navigator, whatever you're looking for. So I'm going to start at the top. We have our policy and procedure. It will just reference you to local policy and guidance. The next one on the navigator relates to your flags, so your any transfusion flags, special requirement flags, any of that, you can log on your flag part of the navigator. And if you log a flag, then that will automatically upload onto your patient storyboard. Now, there is a validated process in place where you will still have to document this with your local blood bank and inform them as well. The first thing I'm going to do is take you through to your blood consent. So all patients that are receiving a blood transfusion must have consent documented in some form. And this is how we do it for blood transfusion. So the blood transfusion consent is separate to your normal hospital admission consent for processes. If you have a patient that refuses a blood transfusion, we have options on the consent process that can be filled in, and that goes onto the patient's file as well. But first, I'm going to take you through a new patient. So we're going to add a consent. And whenever you click New Blood Administration Consent, the consent form will open up for you to complete. On the left-hand side, then you will insert your patient's information and your GMC number. And then on the right-hand side is the smart form that is documented for your patient consent. Now, it's maybe a lot more detail than what you maybe previously have been used for, and this has come off the back of the infected blood inquiry. The hard stops, as you'll see throughout the process, will not let you continue unless you have that completed. So we're going to put in the reason for our transfusion. Let's say there's symptomatic anemia. And then, did I discuss the reason for the transfusion with the patient? Have I discussed the benefits, the risks? And these links on the live system, if you're junior medical staff or you are a junior member of medical staff and it's the first time you're going through this, these links will open up and give you added information if you need to discuss them with the patient. Any alternatives that are available and appropriate to the patient? And did I inform the patient, or was it a parent or guardian if you're working in pediatrics? And then, was I able to give them written information? So all our patient information leaflets are available in our trust on our hub site, so you should be able to give them written information for them to have a wee read of it and ask any queries or questions once they've that done. And then the documentation. Were they happy to proceed? Did they refuse? Was this retrospective? So at the time I was given the transfusion, they weren't in capacity to take consent, and it was in the best interest of the patient to give them the transfusion. That all needs documented, and that they can no longer donate blood. And then once you click on signature, this is going to be a very loose signature, and click accept. And accept that. That will log that on your blood consent. So any of your nursing colleagues that are going to be administering the transfusion will be able to see that that patient has been consented and they're happy to go to the transfusion. So that's our consent. There is the blood refusal pathway, and if you click on those, it will take you through the normal Northern Ireland pathway for the management of the patient that declines a transfusion. There's the advanced directive is also available on there, which lists everything. So it needs to be an in-depth discussion with the patient about what they will and will not accept. So that's where consent is documented. All your orders for blood transfusion then. So whether you are getting organised to take a group and screen, whether you are putting on a prescription for that patient, is all done via your orders pathway. So I'm going to place an order in here for, I want my patient to have 2 units of red cells. And if you click in your orders tab and put in blood admin, you'll see then the blood administration option for your order set will come up. There is a pediatric option as well, depending on the clinical area that you're working in. So the adult blood administration, if you click accept, it will then open your order set for that. You'll see the vital signs can be checked or unchecked for the nursing staff to undertake. But down through this colourful block, this is our special requirements for transfusion. And you'll be able to read through that and see if your patient meets any of those requirements. So we're going to do a group and cross-match and red cells for a patient. So with this order set, it's opening up the sample, and it is also opening up my prepare order and my prescribe order. So this is the full order set for blood transfusion. If you're taking a sample, requesting a cross-match from blood bank, and then doing that written authorisation. So we have a routine sample, and just to note, there are mitigations in place for blood transfusion. Northern Ireland transfusion request form is still in play whenever we go live on the 8th of May. So along with your sample, you will have to send the request form, and you must acknowledge that you're aware of that to remove that hard stop. I'm going to click accept. So that's my order on for my sample, and then I'm going to place my prepare order. I want 2 units for my patient. And if you click copy here, it will automatically copy this across onto your written authorisation order below. We've just completed consent. So if you'd forgotten or it was earlier in the process and it was considered the patient needed a transfusion but we hadn't yet consented them, you can take consent now of this process, but we've already documented our consent. The prepare order would have been similar terminology that we would use for cross-match. So the prepare order is, I want blood bank to prepare 2 units of red cells for me and I need them to be notified. To do that, you're filling in, as normal, our Northern Ireland transfusion request form and sending that to your blood bank. So yes, I'm going to let my blood bank know. So that's my prepare order. And then lastly is my written authorization or my prescription. So why am I giving this transfusion? All the indications. So there is no special requirements for this patient. Reason, so this was a patient that had anemia. They were symptomatic of anemia. We completed our consent. What's the reason for the transfusion? So if a patient, say their hemoglobin's less than 70, you can see the options there, patients that are trending down. If you're looking after hematology oncology patients, there's option there for every patient to consider. Has the patient ever had a previous blood transfusion? So for this occasion, I'm going to say no. And were they ever pregnant? No, because it's a male. Sorry, transfusion reaction, no. Is the patient at risk of TACO? So all patients receiving a blood transfusion must have their TACO assessment completed. So this patient, I'm going to say they have a cardiac. So whatever you select on your TACO assessment, it will open up further options. Now, when we go live, this might have a slightly different layout, but we're going to go with patient has cardiac risk. So they've got a history of heart failure and they're on a regular diuretic. What am I going to do about that? So this is where you're letting the nursing staff know what mitigations do we need to put in place. So we have discussed it and the benefits definitely outweigh the risk. We're going to slow down our transfusion. We're only give them 1 unit and then we'll recheck. They're already on a regular diuretic. I'll maybe consider doing a one-off to cover the transfusion. And we're going to increase our monitoring of our patient. I want this transfusion for today, so I'll put T in for today and the time required. So we're going to have this in this afternoon. So I'm going to put it in for 2 o'clock. And we do have a patient at risk of TACO. I want it to go in a bit slower, so I'm putting it in for 3.5 hours. So that is my prescription. Now, if there was a hard stop there that I hadn't completed, and once I click accept, if I haven't completed it, it'll alert to me and I have to go back to it. As with all orders that go on to the system for the patient, you must sign the order. So once you have your order set on, make sure that you do sign it. So if we have a nursing colleague coming in behind us, they'll be able to go onto this patient's Navigator. They'll see that consent has been documented. They can then go in and look and see that we have a written prescription for this patient for 2 units and review it. So that's on the release unit. So they can go in and review the prescription and they can see there's no special requirements, the reason the patient's getting the transfusion, the TACO risks and the rate they're putting this in for. So that information can be checked. In order for staff to transfuse to the patient, it must be prescribed. Nursing colleagues, vital signs, everything is easily navigated through the Navigator. And then once we're transfusing the blood component onto the clinical area, nursing staff will get organised. If you're involved in the transfusion as a member of medical staff, I'm just going to quickly take you through the next flow so that you're aware of it. So the nursing staff will release the unit, and this is releasing it into the flow sheet. And you'll see that this would have changed from 0 to 2. They'll have done their baseline observations, checked for cannula access, made sure that the patient's informed and ready to have that transfusion. They'll do all their baseline checks, and then they'll request the blood component from the porter. And once they have that, this is a direct link to porter requests, they will request that link or that blood component for the porter to go and collect it. So our blood collection form is still in play. And then they will start the transfusion once it arrives on the ward. And it's very easily flowed through. They do all their patient identification checks, follow everything through, and then they begin the transfusion. And that's where they can check the prescription again to see that it has been prescribed and start the transfusion. It allows them to select their access, and then it will take them through the bedside checks. And you can see the prescription is always visible to the staff that are administering the blood component to the patient. We're scanning our units now into our onto the Epic system. So we'll be scanning patients' armbands, and then we will scan in our units onto the system. I'm just going to take you quickly through it. And we'll put in 300 mils. And then this is our bedside check. So the current safety checks that we have are still in place, and they will have to be documented on the Epic system. So my integrity check, my compatibility check, my donor numbers check, any special requirements, positive patient identification, correct given set, patient identity at the bedside, and I have my right patient, right blood. Pulse is 99. Click accept. And then it will ask for dual sign-off. So in case you are a member of medical staff and you're involved in that 2-person independent check, a nursing colleague may ask you to come over. You will still have to undertake those safety checks, and once you click sign off, it will ask you for your login, and the transfusion will start. So that's that transfusion running. Transfusions will stop and be taken down by the flow sheet as well. So I'm just going to do a quick recap really for the important things for medical staff to bear in mind when they're using the Navigator. Find your Navigator, which should be in your more arrow under your list and blood transfusion. Work through the Navigator links on the left-hand side, but the important ones to note are your blood consent, making sure that it is documented, and it is documented for this admission, that your orders are done through your order set. So the adult blood administration order sets, there's a couple set up there where you can take the sample, the prepare order, and the prescription all at the same time, or you can just do the prepare order and the prescription. And then your prescription, once you have that done, staff can check that. The other thing, just to note, just in case, is massive transfusion protocols. So currently, within all of the live trusts, and Southern Trust and Western Trust included when we go live, massive transfusion, massive blood loss, massive hemorrhage scenarios are not built into EPIC. So you will go to your current processes, use your blood transfusion booklets to document the transfusion and record the blood components that have been given to the patient. So whichever trust you work in, your normal process that you currently do for massive transfusion activation is still in place. That has not changed. And that's the same for emergency group O blood. We will be using our blood transfusion booklet to document the blood transfusions transfused to the patient. And then when the emergency is over, that will be uploaded onto the patient's file via the media manager. Rebecca, I think, is that everything? Do you think have I covered?
Thanks, Bruna. Yeah, that was absolutely fantastic, really thorough summary of what we need to sort of know as medics from our perspective. I really like the fact it's a multidisciplinary navigator, that everybody can see what all part's being done and can access it. So I think hopefully that'll be, mean when we're doing the blood transfusions, things will be hopefully quite clear for everybody involved. I did want to just plug the blood transfusion resource tile that I've got on the Southern Trust page. Do you mind if I grab the screen? Is that okay?
No, work away.
Great. Hopefully everybody can see this okay. It was just to sort of reiterate that we do have a blood transfusion specific tile on the medical and dental resource page, but when I click into that, there's a really helpful document which, if you're someone like me that also likes to read at things, sort of goes through the electronic contingencies, rediscusses the massive blood loss protocol as Bruno already detailed for us, and things like that. So this recording will also go onto the SharePoint page, so yes, if you want to sort of listen and watch Bruna's great demonstration back again, or check out the mitigation document, and there's the specific points on the SharePoint page for you guys to be able to access it. I think I'm going to stop sharing at this point, but